Good afternoon. This is Dr. Bobby Cawthron, lead veterinarian with Aspen Grove Vet Care, coming to you from Fort Collins, Colorado. Today we're going to talk about dental care and specifically for dogs. On another blog we're going to talk about cats because they are unique creatures and have their own needs. But for dogs we're going to talk about the three things that we want to go over. Number one, and probably the biggest thing that's going to help with their dental health, is home care. You notice it's number one because it is the most important thing you can do to help your pet in continuing their life, because dental health equals long-term health. It really does. We're big proponents at Aspen Grove on the dental care of our pets. Home care usually does consist, and our best possible treatment is to brush your pet's teeth on a regular basis. This can be a daunting task for a lot of pet owners, and we know that. And there is some tricks of the trade that can help to get you to a point where your dog is trained to allow you to do that. Brushing their teeth does need to happen approximately 3 times a week. It's often. Brushing your pet's teeth once a month is probably not doing a whole lot. It's just like you brushing your teeth only once a month. You're not doing much. You need to do it often enough to get rid of those plaque colonies that form approximately every 24 hours on your pet's teeth. So brushing, getting in there with an appropriate toothbrush and appropriate toothpaste for your pet is great. They have some really nice toothpaste that are flavored these days, so if your pet enjoys chicken, turkey, beef, salmon, malt, sugary flavors, they have all of those available to you. Most of these toothpaste are enzymatic, so not only does the physical action of brushing help to remove those plaque colonies, they have enzymes that break those plaque colonies up so that you can keep that mouth as healthy as possible. Now there are, of course, times in which a dog is not going to let you brush their teeth. There's a lot of pet owners that just don't have the physical capability of doing that, but also dogs that are just not going to be compliant. And so we have other alternatives that are out there. So there's a lot of different products that you can use. Some of the more productive ones are probably going to be your dental chews. And you do want a dental specific chew. Some people will automatically go out and get bones or something along those lines, which gets you some physical action of chewing, but they can be problematic. They don't provide a lot of enzymatic cleansing, and some bones with certain dogs can break teeth. Fracturing teeth is not a good thing. It creates even more problems and further tooth loss in that situation. So dental specific chews are a great product to use, because if you can find one that a dog will take and methodically chew on for several minutes, and that's okay if they consume it because that's what they're meant to do, it will literally brush their own teeth that way. And I find those can be really great. So again, brushing the best, chewing is good. It's still a great product. There's other things that are out there that do tout that they help. There are little sprays for the mouth, water additives, food additives, things like that. There's a ton of them out there. How well some of these work, it kind of depends on the patient. It kind of depends on the product. So a lot of times a specific conversation with your veterinarian with that product can help to sort some of that out. But I think some of those can still be useful, especially for pets that just don't chew. And we'll find that that does happen. We're going to go into kind of professional care at this point because that's still an important part of it. Even if you brush your teeth on a daily basis and floss twice a day, you still need to go see the dentist periodically and get a scaling done. Check to see if there's any tooth diseases that are coming in, as well as any problems down in your periodontal pockets. And the same thing we're going to recommend with our pets. What that means, however, is that they have to go under anesthesia for us to do a good job. It's almost impossible for us to do a good subgingival scaling in an awake patient. That's not going to happen. Plus, being able to see all 4 sides of those teeth, especially in the back of the mouth, around the tongue, is almost impossible in an awake patient as well. And I know this becomes a big concern for a lot of pet owners. And to touch base on it a little bit, we feel that the benefit of going under anesthesia and cleaning those teeth is much, much bigger than the risk of the anesthetic procedure itself. Anesthetics are very safe these days. Our screening of our patients is better these days, and 99.9% of the time, it's going to be of great benefit to your pet to get a good professional cleaning and evaluation done. While they're under anesthesia, we're going to probe every single gum. We're going to chart all of those concerns that we have. We're going to take x-rays of the teeth that we have concerns about, and we're going to find problems that you might not even know are there. And we're going to fix those problems while we're there. So they're going to get a full evaluation and treatment done all in one anesthetic procedure, and that's going to be of great benefit. So if you have concerns specifically about your pet and your needs for anesthesia, it's something that you just have to have a good relationship with your vet, have that discussion, and give those concerns to them, because they can talk about making sure to reduce those risks. The final thing we should talk about is just breed-specific disorders. I think people should really remember and understand that certain pets are going to have more dental disease than others. We can kind of group them a little bit. Small dogs absolutely have more dental disease than large breed dogs. Number one breeds that we see with dental disease are going to be our small toy poodles, Yorkshire Terriers, miniature schnauzers. Those guys, and dachshunds I should throw in there as well, will all have a lot more dental disease than we will have in a German Shepherd breed, Labrador, something along those lines. Part of it is our small dogs. We breed them smaller. We take them from these large dogs and we bred them down, and we've kept their mouths really, really crowded that way. So they have a lot of crowding. They have a lot, unfortunately, of teeth that are misaligned, and they will also just seem to be genetically predisposed to allowing more tartar to build up. They're also not very avid chewers like our large breed dogs, which again tend to keep their teeth a lot cleaner. So if we think about those two groups as it is, we have to do more work with the small dogs, meaning that you need to start at a young age training your little pet to be able to accept a toothbrush, accept brushing, and accept some of those kind of things and interventions that we want to do. And just understand, with a small breed dog, they're probably going to be anesthetized more often for dental issues than we will with our large dogs. Now, each breed, of course, has some predispositions to certain tooth diseases, cavity-like lesions, and other problems. But that, of course, is something to discuss specifically with your dog and your veterinarian to help find that out. For more information or details on this subject, please visit our blog on our website.